Mr. Chairman and Judy, we are live.
Welcome to Senate Corporations. Bills up today, 38, Community Behavioral Health, University Water System, House Bill 198, House Bill 75, Voter ID, House Bill 163, Federal Congressional Elections, and House Bill 187, Elected Official Residency Requirements. Roll call, please.
Senator Boner.
Excused.
Okay. Senator Case.
Present.
Senator Nethercott.
Excused.
Senator Scott.
Here.
And Chairman Driscoll.
Here. We have a quorum. So pending no more fire alarms, Representative Larson, we will take back up House Bill 38. I think you were pretty close to at the end of your testimony. Welcome back.
Thank you, Mr. Chairman and members of the committee. Just perhaps just a real brief review is in this bill. We, as we look to establish how we fund mental health services to the state of Wyoming and what our responsibility is in establishing the policy, where this bill establishes priority populations based on input from industry and from legislature and from the department. And if we put that into place, and that's kind of where I got to the other day, if we put that into place this year, then this coming year, if you start on page 21 of the bill, during this interim, the Department of Health, along with the providers and other stakeholder organizations, will meet together and start to outline the eligibility requirements for the receipt of state funding, eligibility requirements for the essential subsidy payments. And Mr. Chairman, that's important. If you go back to 17, we talked about some of those centers that are in more rural areas and how do we help them if perhaps they'll need some operational subsidies, and how does that all play out? And so we put that requirement in here, but we also, as they start working through the interim, they'll refine that and probably come back with some recommendations on how to implement it. Then they'll talk about how to pay for performance, the methodology and standard for those priority populations, case management, and housing and crisis shelters, and what the reimbursement for that. Most of these facilities have some housing and shelters that for people that have persistent mental illness issues and or substance abuse issues that we pay for, and figure out that methodology there. And so, Mr. Chairman, I went through the repealers the other day. I would be happy to answer any questions, or we may even consider letting Chairman Wilson finish up, and then maybe we can tag up on the questions. But
Thank you, Representative Larson. Chairman Wilson, if you would like to pick up from here and go on, I'd be honored. Thank you.
Thank you, Mr. Chairman, committee. So just to certainly the chairman of the committee, Larson, ably presented it for you. As you can imagine, subject of this type, we had a lot of robust discussion over the course of the interim and going forward. So I'm just going to touch on really a few points from that because those questions may come up again on the floor. So looking at pages 6 and 7, which are the definitions, there had been a question about some of the mental illness definitions. So on the bottom of page 6, you see that paragraph 14, adults with acute mental illness. So those are the people that, you know, your basic Title 25 type people who either have been there or have come out, or obviously you want to prevent them from going back again. Then, as we discussed in committee, you know, we didn't want for people to have to end up in Evanston before they would get help. I mean, there are many people who have a severe mental illness, but with case management and staying on their medication, they're able to stay in the community and even work. And so we put in paragraph 15 on the top of page 7 to basically make sure that people who could be maintained in the community and do okay were inserted into the bill. So that is that paragraph. It was interesting as I tried to come up with a definition of that. I thought, well, I'll just go on the federal site and pull something off. And in reality, there is nothing standard across the nation on to fit that category really. So I plucked some out of SAMHSA, which is we're used to our labor definitions. I won't forget what the S stands for, but it's the Federal Agency Mental Health and Substance Abuse. So that was developed there to really try to adjust those type of people. Bottom of page 7, and turning over with the families of high risk, we heard from DFS that there's a significant need to be able to provide services to families where the child is in danger of being removed from the home. And right now, to be honest, those people don't get access as fast as we would really like to have them do. You know, you'll hear discussion, I think, anytime you try to set up a prioritization, there are going to be some people that are perhaps less priority than they were before. I mean, that's the nature of it. The beginning of this followed on a lot that you will all recognize. I'm not talking to freshmen this time, fortunately. The many years that we've spent on the criminal justice reform and all those bills that we've had the last few years, and having found out in the legislature and in the committees, the difficulty that people coming out of prison had in accessing community mental health services. So those people, as we have heard, those people with really severe needs, we have put them to the top of the priority list. That's certainly plain enough. So, Mr. Chairman, then I think you probably identified on 10 and 11, that's almost the easiest place to identify the tiers, A, B, C, D, and E, tier 1, then tier 2, indigent with high needs, and G is tier 3. The other thing I want to touch on page 15, paragraph 6 there, we just want to be really clear. It says prioritize the behavioral health centers, and that's just a renaming in this bill of the community mental health center to reflect current language in the federal lines. Notice line 9 says, if a behavioral health center cannot provide sufficient services, the department shall select the most appropriate provider. And we heard some concern that there were certain categories of providers that the behavioral health centers might not have on staff and that patients would need them. We want to make it very clear that obviously the patient's needs need to be met. And so you may go outside. We did also hear some concern that other providers in the private sector were maybe not having as much access to general fund dollars to see these patients as they would like. And the two things for that is, one is on the federal money from SAMHSA, they require that money go to the state or to nonprofits. So any of the grant money that comes through the feds is specific that way. The other discussion would be just in general, as you know, as we go forward we hope that the budget is not entirely driving this conversation. Anytime you fund a program through general funds and you set up something in statute, you should identify what you're aiming at. But there is a certain efficiency in focusing our general fund dollars in a certain area. Certainly other providers are not in any way prevented from serving low income patients on a sliding scale or pro bono. That's always available to all of us. And then I think the last two things I just want to reiterate again, Mr. Chairman. Page 21, as Representative Larson said, we have the requirement for the department to consult with providers. So there's a number of layers to this. We've got the statutory change on the prioritization. Then we will have a period of consultation again between the department and the providers to really set up the design of how this will all work. They need to report to us. You can see on the top of page 24, to the Labor Committee in September. It was originally earlier in the year, but what with the delay of session, we didn't feel like, I think we had a July date and that just wasn't feasible. So that's moved to September. The other thing that we did at the bottom of 24, because we continued to have some discussion, as you would in a topic of this magnitude, about whether the prioritization was exactly what we wanted. And so what we did was insert an obligation for September 1, 2025 to have the department come back, and you can see on page 25, lines 4 and 5, to include recommendations for modifying the priority population or the tiers. We had considered a sunset date, but we discovered that that would inadvertently delete the entire community mental health program, which we didn't want to do. So rather than some sort of sunsetting type thing, we just wanted to make sure that the effect of that, which was the legislature surely does need to reconsider this in a few years and make sure that we've gotten what we were hoping for. And Mr. Chairman, that's all I wanted to add.
Mr. Chairman, I would comment, I participated in this as the then chairman of the Senate Labor, Health and Social Services Committee. And we did push the subcommittee to get its work done and get a bill out because we thought it was going to be essential in terms of dealing with what we were going to have to do in the budget to these people. And I retain that view. And section 3 that Chairman Wilson was just referring to at the end of the bill is really a product of that. We didn't, with the pushing of that, some things could not be fully dealt with because we felt it was essential to get the priorities set so that people could effectively deal with the budget that they're going to get.
Thank you, Senator Scott. Further questions? Further questions? Thank you. Nice job, by the way. That's kind of a lengthy bill and you guys did good. Testimony in the audience. Welcome.
Thank you, Chairman Driscoll, members of the committee. My name is Stefan Johansson. I'm the Deputy Director for the Wyoming Department of Health. Just wanted to offer some brief comments as we have participated over the interim, both with the Labor Health Committee and the Joint Subcommittee on this issue. And we stand in support of this bill and ready to work with the stakeholders in the legislature to implement this over the interim period in the years to come. Wanted to offer just some general comments on what problems that we're trying to solve in the department and that I think the state is wrestling with, that this bill is a tool to help. There's been many years of discussion, as you all know, about issues with our state-funded mental health system and problems that we'd like to solve, including Title 25, Title 7 for forensic behavioral health patients, criminal justice reform, as Chairman Wilson mentioned, various high needs and complex clients like high needs children, families, folks that rely on or have to overly rely in many cases on institutional levels of care, and obviously recidivism back into higher cost institutional levels of care, both in the healthcare settings and the correctional settings. The state struggles with this, the department struggles with this, and it's not just us. I think you'll hear from corrections about their issues with access to services for probationees, parolees, et cetera. The Department of Family Services and many of the clients and high needs kids and families that they serve, where we just don't have all of the resources in this state that we would like. And certainly your counties, your communities, your hospitals, your county attorneys, we all kind of struggle here in Wyoming with having the best resources for clients, especially those that present with higher acuities and more complex both social and healthcare needs. It's really difficult in Wyoming to have all of those resources. So as you know, we're very spread out, small population, and historically going back to the 70s when the community mental health system was really established by the legislature, it has historically been grant funded to have infrastructure, have resources for everyone, kind of a general access model in as many places, as many communities as we can. That was obviously necessary in that time period, but over the decades, the coverage for mental health and substance abuse services, while not perfect, has certainly evolved. With the passage of the Affordable Care Act, there's more coverage for mental health services in private insurance. There's more coverage in the Medicaid space for mental health services for many populations. And so I think this bill deals with some of that evolution of the private market and the coverage for these services in trying to answer what should the state's role be with the state general fund dollars for these services. And that's where you see the prioritization. So we do think this bill is really a tool to help improve two things. Number one, solve an access problem, and an access problem for those higher needs, higher acuity populations that are outlined in this bill, that we really struggle as a system, and it's nobody's fault. We struggle with a system to provide those resources, and we believe this is a tool to help tailor and target those general fund dollars so that over the years we can build infrastructure and services and incentivize the service delivery for those clients. Secondarily, Mr. Chairman, as Chairman Wilson mentioned, there's just a reality of the budget. And I think doing more with less is everybody's task these days. And taking the general fund dollars in this system and trying to do more for a smaller population, so a prioritized population, the department believes can serve that population well, while also leveraging additional resources that are out there, like subsidized private insurance that can act as a pay source, Medicaid that can act as a pay source, and other, as Chairman Wilson mentioned, other private provision of services to a less acute, more of a general access population. And finally, Mr. Chairman, again, I think in the context of the Olmstead decision from years and years ago of the need to serve folks with disabilities, folks with severe mental illness in their communities as a first priority, as opposed to institutions, we do think that this bill sets us on the right path to rely less on higher cost, higher restrictive levels of care, that the department certainly supports that role. Just in terms of process, Mr. Chairman, as you'll notice that Representative Larson and Chairman Wilson went through, this bill does have an effective date for the most part in the future for when the system would be implemented. And the department will take the direction from the legislature to design the system, work with the stakeholders over the interim period or periods to come. This is very similar, Mr. Chairman, to how the Facilities Task Force operated, wherein that group really set the concept, set the policy in statute in the first iteration. The groups worked over the interim with the state hospital and the Life Resource Center to design what would based on the mission that we saw in statute, how would we operationalize it? What would we need in terms of construction dollars, policy change, further statute change? And we came back with the task force over the interim period and ultimately to the legislature to make changes in that second iteration. And actually the Facilities Task Force, it's still going on, but it really had 3 iterations prior to shovels in the ground for those 2 facilities. And while that's obviously, physical plant, facility level of care, the concept is very similar in the department's interpretation here to work in designing and implementing that system over the next interim period and potentially bringing back necessary changes for the next session as we gear up to turn this system on. So, Mr. Chairman, happy to answer any questions that you might have for the department. I believe we have some folks from our Behavioral Health Division on the line if you have questions about that current system. But otherwise, Mr. Chairman, I'll stand for any questions you might have.
Thank you, Mr. Hannison. Questions? Senator Scott.
Mr. Chairman, I have 2 questions. You mentioned the interplay between the Medicaid program and this bill. With the Medicaid funding levels, are you getting adequate participation from the private sector to meet the needs of the Medicaid people that need mental health services at the current reimbursement level? And do you anticipate that at the reimbursement level, once the current budget bill gets into law, the reduced reimbursement level, you'll still be able to get adequate participation from the private sector?
Mr. Chairman, Senator Scott, it's a great question and the answer is a bit of a mixed bag. I think you're right to point out we will likely see a reduction in Medicaid reimbursement rates across the board with most providers as a result of this next supplemental budget. In terms of what we've seen over the years in participation to serve Medicaid members by private mental health providers, that has grown since 2014, pretty much on a linear a linear path. So there is much more availability of private provision of Medicaid, of services for Medicaid members that are, at least by their revealed preference, accepting the rates. Now, I think there's different opinions on how high those rates could be or should be, and we try to work within our budget and within our upper payment limit in Medicaid to set those as high as we can. Second thing, Senator Scott, I would mention is I think the good thing about this bill and our community mental health system is that we believe as a department, our community mental health providers, what are referred to as behavioral health centers in this bill, should be set up and are set up to offer a wider array of services than the majority of private providers that are out there. Again, it's a mixed bag, but just like any insurance plan, Medicaid being one of them, those insured members can select an enrolled provider to go get their services from. A community mental health center really is established to offer that wider array of services, many of which can be reimbursed by Medicaid, but some of which cannot be, that Medicaid won't cover. We think this bill strikes the right balance between leveraging that Medicaid resource and continuing to have our community mental health centers be the bedrock of service provision for your higher needs clients. Senator Scott, I'm not sure if that fully answered your question. I'm happy to elaborate.
More or less, Mr. Chairman.
Thank you. Further questions, Senator Shaw?
Yes, Mr. Chairman, on bottom page 15, the list is on the top of page 16 of the priorities. How far down the priority list do you expect to be able to adequately fund, given the budget that you're getting?
Mr. Chairman and Senator Scott, subject to what does happen with the budget, but based on what we've seen in both chambers so far, I think with this prioritization and with again, pending the design of the system over the next interim and the eligibility standards, the department's relatively comfortable that with the budget as we anticipate it to exist, we will be able to serve all of the tiers or fund all of the tiers in this bill in this priority population group.
Further questions, committee? Thank you. Sounds like we've got a couple of our state agency people online, if we can admit them.
Mr. Chairman, I just submitted the Department of Family Services.
Welcome, Ms. Schilling.
Good morning, Chairman, members of the committee. My name is Lindsay Schilling, and I'm the Social Services Division Administrator for DFS. I'll be brief with my comments, but we did want an opportunity to express our gratitude for the work that's gone into crafting this bill. And we're encouraged by the intentional focus on families that DFS works with. And that's evidenced in the inclusion of the definition families at high risk. In state fiscal year 20, 37% of the children that came into DFS custody did so as a result of a parent or guardian substance use disorder and a subsequent neglect case. For context, as of March 1st, we had 913 children in DFS custody. So that would be 337 youth in state custody as a result of those particular challenges. So we believe with a focus on ensuring timely access to treatment evaluations and services, we would hope to see a decrease both in the number of youth coming into care, as well as the length of time children stay in an open case with DFS. So with that, short and sweet, I'll stand for questions, but certainly very encouraged by the direction this bill is going.
Question from Ms. Schilling, committee. Thank you. Do we have anyone else in the waiting room on this bill?
Yes, Mr. Chairman, I just admitted Ms. Heather Babbitt, and we have about 4 others after her. Mr. Chairman, she just needs to turn her video on. I believe she might have her microphone on.
Welcome, Ms. Babbitt. Can you hear us? Now you're muted, Ms. Babbitt.
Sorry about that, Mr. Chairman. Are you ready for me?
Good morning. Welcome.
Good morning. I'm sorry about my technical difficulties. Mr. Chairman and committee, my name is Heather Babbitt, and I am the new Deputy Director of the Department of Corrections. And Director Shannon wanted me to convey his sincere regrets at not being able to join you this morning. With the chair's permission, I do just want to provide some very brief information and numbers. While we're not for or against this bill, our population is certainly in need of these services. We release about 550 inmates annually into the community. And when we look at those numbers each year, in 2019, there were about 467 parole revocations. And of those revocations, 281 were from substance use violations, or about 60% of those revocations. And in 2020, when we look at revocations, there were about 321. And of those revocations, 187, or about 58%, were from a substance use violation. So with an increase in access to treatment, we would hope to see those revocations decrease. And so really, again, it's important for our population to access treatment. And with that, we would stand for questions.
Questions for Ms. Babbitt? Good information. Thank you.
Mr. Chairman, we have Ms. Peggy Trent.
Mr. Chairman, thank you very much. My name is Peggy Trent. I'm the Albany County and Prosecuting Attorney, and I am not speaking on behalf of the Prosecutors Association, but in my role as the county attorney. First of all, I want to thank the subcommittee that worked on this House Bill 38, and specifically to Representative Wilson and Larson. This is a great first step, in my opinion, towards moving forward and really taking and examining our mental health system and priorities. I just wanted to highlight some of the good points that I'm seeing and direction. And then just to say is that if the bill moves forward and it comes back for revision or other, just to keep certain things in mind as the subcommittee moves forward or reports come back. Specifically, I would like to just applaud that some of the revisions dealing with the gatekeeper process in our community. We do have an active gatekeeping process where we are actively diverting individuals. We, as a matter of fact, did our first revocation from the program yesterday, where the system worked instead of going back into our prison system and working through the process to get those mental health needs. I think it's outstanding to start move towards a uniformity. So it doesn't matter where you live in the state of Wyoming, you're getting fair and equality to services that are occurring throughout the state of Wyoming. I also want to applaud the ability to start move towards getting uniformity in payment, meaning at this point, Albany County has to negotiate, even though the county is responsible for payment of detentions up to the 72 hours and thereabout. We need to get that uniformity. It's negotiated at different prices throughout the state of Wyoming. So I may be paying more in my county, in Albany County, per day to house a patient that is under a Title 25 commitment than in other parts of the state. And I believe that this is a good step in moving in that uniformity that we need to see. And although we do need to embrace, which this bill does, the uniqueness in each community and our unique population, I feel the bill adequately dealt with each of that. So I want to applaud as we move forward in that direction. Equally, I think it's incredible that this subcommittee actually took the time to understand the statute of mental illness, but also substance use disorder, and to correct substance abuse, because it's a big difference and was causing a lot of confusions to mental health professionals and to the county, as the county attorney, as you move forward. The definitional sections, essentially you've determined the priority which needed to occur Unfortunately, I know that there's indigent individuals that need access, but I think as the bill starts to prioritize who falls into those categories, and in my mind, it was prioritizing populations in the systems, in our current systems, which is jail, Department of Family Service, and our involuntary Title 25 commitments. I found that I really like the idea that it varies from community to community. I guess what point I want to make sure that isn't lost in the translation, this is the general overview of how the state funds are being spent and prioritizing, but we can't forget to drill down to reward communities similar to Albany County, where we are diverting individuals to outpatient, diverting individuals out of facilities. We do need crisis facilities available in regional situations. And I did note that this bill indicated kind of the behavioral health centers being established within, I think it was 35 miles. So I understand, why we need to do this. I just hope as we move forward with this, that we don't lose sight of rewarding those and funding, drilling down further the priority to do more prevention, more on the front end to avoid the high cost of that intervention in those crisis beds. And again, I watched it yesterday happen successfully. And it was a very proud moment that I had to take a step back, that finally maybe we are achieving what we've seen accomplished with juveniles and diverting our mentally ill from the system. And I don't want to take time, but I want to also, I just think you need to hear some praises of your work at times. I think there are some issues within this, but what isn't? You have to take this first step. I am a person that likes to get items done quickly, those that work with me at Department of Health and Department of Family Services. I think leaving this out to 2025 or whatever date you put in the future is too far out. I think there needs to be a tighter rope on this, if you will. And I say rope, not string, because I think this could go in bad directions if it isn't kept contained and having these dialogues and moving quickly on this. But with that said, I just wanted to give you some praise and thank you for the work you've done. And I know you probably don't hear that a lot from county attorneys when it deals with Title 25. I still feel we have a lot more work to do on that statute. But I just want to thank you, and I stand for any questions you may have as to Albany County.
Questions for Mr. Trent? Thank you very much. Go ahead. Welcome.
Oh, there it is. Mr. Chairman, members of the committee, Dr. Hollis Hackman. I'm a psychologist, and I don't think I've ever been in front of the Corporations Committee before. I'm used to be in front of the labor committees. And so I represent the Wyoming Psychological Association. And if I might, just briefly, there are 329 license holders in the state. Probably a third of those have out-of-state addresses. The rest are in-state, and probably a third of the total are members of our association. So I want to share and amplify what the previous person just mentioned, and that is that our hats off to the committee for all the hard work they've done on this bill. And we think that there's been some real improvements, especially in and around the definition of gatekeepers and how they function. And so that's a positive. Having said that, though, my association's in opposition to this bill for a few reasons I'll just touch on briefly. Our primary concern is that this may reduce access to care for certain categories of patients. The tiers 2 and 3 folks, we're concerned they may fall through the cracks. And one of our concerns as relates to that is that often folks will begin to seek treatment before things get worse for them. And if they're not able to get in and get seen because they don't fit into the tier 1 category, that might result in they're not getting the treatment that they need, and then they may deteriorate, and then it might be a Title 25 issue. So we have some concerns about that. we're also concerned about the possibility that this may limit a patient's choice of provider. And I appreciate Chairman Wilson's comments about some of the things that have been attempted at trying to make sure that people have access to a variety of providers. But the truth is, not all of the mental health centers in the state have psychologists that work for them. If you talk to my mental health center up in the north east corner of the state, they'll tell you that, well, they can't afford psychologists, and so they don't have them on the staff. And so if you're a tier 1 person and you need to go to the mental health center because that's the primary source of your providers, and you happen to need a psychologist because you need a neuropsychological evaluation or maybe there's a differential diagnosis that has to be figured out. If you don't have somebody with doctoral skills in that location, then how you access that person isn't real clear to us. So we have concerns about that. The priority categories, they are interesting to say the least. We would say that they are rough diagnostic categories, but they're certainly not taken out of our diagnostic manuals specifically. And so if I'm a clinic director at one of the mental health centers and we do assessment of patients coming in the front door, and we use standard diagnostic manuals that we use in our profession. This overlay of this tier system is another, it's going to complicate things, I think. And I wouldn't want to be the clinic director that has to make decisions about, well, who's going to get care based on this priority category system versus where my training lies in terms as a clinician. So some concerns there. I would also mention it's interesting if this is a budget-driven effort here, and I understand that it is, I would just note that there are financial qualifiers for tiers 2 and 3, but not tier 1. So, so that's kind of interesting. And another point related to the folks that are tied up in the criminal justice system. I would just note that I've kind of followed this over the years with the legislature, and I think what happened at the state prison was that when funds were reduced for treatment in-house, the recidivism rates went up. And I would just point that as a clinician, you essentially want to strike when the iron is hot. When a patient is motivated to make a change is typically when they're in the most trouble. If they're just coming off of a detox, that's a good time to talk to somebody about maybe they want to make a change in their relationship with substances. If somebody's in prison as a result of their poor choices, that would, I would think, be the time that you would want to try to intervene, and as opposed to after they're released from prison. And lastly, I would just suggest, in my humble opinion, that if we consider Medicaid expansion, that might solve this issue rather nicely. It'd be great if we could see our mental health centers and our mental health providers funded not through the general funds, but through a Medicaid program. And with that, I'm not very good at answering questions when I'm on stage like this, but I would give it my best shot, Mr. Chairman.
Questions for Dr. Hackman? Senator Scott.
Mr. Chairman, you mentioned Medicaid. Does that mean that you believe the current Medicaid reimbursement rates for psychological services are adequate?
Mr. Chairman, Senator Scott, I don't know that it means that. Many of our providers accept Medicare and Medicaid patients, and we're happy to provide services. Of course, we would like to see greater rates of reimbursement, as likely anybody would, but we're happy to provide services, and we provide a lot of pro bono services as well to folks. And so our concern as professional folks is patient welfare, and that always comes number one. And questions about reimbursement those are further down the list.
Thank you, Mr. Chairman. Thank you, Doctor. It looks to me like an enormous amount of work has gone into this from people that are just a heck of a lot brighter on this than I could possibly ever be. But, and your criticisms sort of come in at the tail end. And it's like, I don't think I can vote against this bill based on the criticisms you offered and some of the criticisms I've gotten by email. There's just not enough there. And I'm not smart enough to fix this bill the way you would like it. I mean, honestly, I just guarantee you this bill's going to pass. It's going to pass out of the legislature, and we're going to maybe have to tweak it as we go along. But folks that say vote no on this, I think it's not, frankly, your criticisms seem light, like there's some minor problems. And then there's just this enormous body of work that's gone into it by some smart people that I really respect, and I just can't go against them. So if you got some specifics, we could look at it, but right now, all I'm hearing, you got it? I'm sorry, and it's not really, it's sort of a question. You see where I'm at?
Yeah, Mr. Chairman, Senator Case, I do understand what you're saying, and we try to be involved in these bills as they're developed during the interim. We weren't at the table as much as we would have preferred to be during the interim on this particular bill. We were involved in other bills, but we're very happy to be involved with tweaking this bill as it goes forward. And we want to see the system improved for the benefit of patients in our state. And we're very, very willing to be involved as we go forward. I hope that answers your question, Senator Case.
Senator Scott.
Chairman, did I read your comments right as being mostly that you're afraid we won't have the resources to implement this at the level we'd like to? And I would say that's just a fundamental problem we have given what's happening to our economy here in Wyoming.
Mr. Chairman, Senator Scott, yes, we are concerned about the resources that are available. And to that point, again, Medicaid expansion might be a way to address that.
No comment. No comment.
Depends on leadership.
Not today. Thank you. So, any further questions for Dr. Hackman? Thank you.
Thank you very much.
Do we have anyone in the waiting room? We got 3 more, so we said, Judy.
You know, there's a provider from Lander I'd really like to hear about.
We'll get to him.
Yes, Mr. Chairman.
Get him in.
We can go ahead and bring them in a couple at a time so they're teed up and ready if we can.
Okay.
Or 3 at a time even. We'll.
Mr. Chairman, we have Mr. Buck Gwynn in, Mr. Scott Hayes, and Ms. Cheryl Foland.
Welcome, Mr. Gwynn. If you would like to go ahead and introduce yourself, and we'll go from there. You're muted, sir.
Mr. Chairman, my name is Buck Gwynn, Legal Director with Protection and Advocacy in Cheyenne. I thank the committee for the invitation to be able to participate today. Protection and Advocacy has been around in Wyoming since 1977. We do not lobby or take positions for or against legislation. I'm here today to provide some information to the committee on an interaction between the core concept of the bill and controlling law that may be of importance for the committee to consider in its informed decision process. The core concept of providing tiers of care is at odds with controlling federal law and controlling decisions that the state has entered into in the settlement agreement in the Chris S. litigation. The Americans with Disabilities Act Title II provides for a community integration mandate. That includes the provisions that were interpreted by the U.S. Supreme Court in the Olmstead case and interpretations by the United States Court of Appeals for the 10th Circuit in the Fisher versus Oklahoma Healthcare Authority case, both of which are binding upon all of us. The provisions in the ADA Title II Community Integration Mandate include the protection of people who are in the community, receiving community services, who want to remain in the community and continue to receive services, who are placed at substantial risk of unnecessary institutionalization if those services are reduced or eliminated. The tiering of the system directly conflicts with two provisions of the Chris S. settlement. Section 2.03 of the settlement provides the state's commitment on this, that there will be no regression from or obliteration of the advancements that have transpired in Wyoming's mental health care system since initiation of the lawsuit, and that further advancement will be fostered. The very next section provides for Olmstead compliance and the services in the least restrictive and most appropriate environment, and provides that there is a commitment of the state to advancement of community-based mental health services for all Wyoming citizens, regardless of age, and it goes on from there. Section 3.11 in that agreement provides that no severely and persistently mentally ill adult, severely emotionally disturbed adolescent, and severely mentally ill adult shall be denied community mental health services by the state of Wyoming or its contractors due to an inability to pay, and consistent with Olmstead. These agreements the state has made, and they're binding here. The tiered system is going to create a reduction in services for some people. As Chair Wilson noted, that some people will be less a priority than they were before. And as Mr. Johnson noted, that there will be more services for a smaller population. As Dr. Hackman noted, that there will be a reduction in services. It's precisely that interplay that is at issue with both Olmstead and the Fisher case, as well as ADA Title II, Section 504 of the Rehabilitation Act. There's also a question of the interplay with the New American Recovery Act and some of the provisions with that and the implementation that's going to come down the road on that, involving money follows the person. And is there a crossover implication there that has not yet been tested, has not yet been seen? There is an interplay there. There is a potential that this funding model and this priority model would create a situation where instead of money follows the person, it becomes the person follows the money, that the services that are available and are reimbursed are the only services available, and that will lead to substantially higher institutionalization rates, substantially higher cost to the state, and a violation of the controlling law. We wanted just to call this to the attention of the committee for its consideration and for its informed decision-making in this process. With that, I thank the committee and thank the committee for the service, and I am willing to stand for questions.
Mr. Chairman, it appeared to me in this bill that we were setting the proper priorities when we're putting the individuals who are really at risk for institutionalization at the top of the priority list to guarantee they get services. So I really am surprised by the testimony and wonder if there isn't a confusion between a demand for all services for everybody, which is impossible, Mr. Chairman, and which would really deny the ability of the state of Wyoming to set priorities, which I think would be blatantly unconstitutional. And it seems to me that this does comply with the decisions, and I do say to the witness, I do not understand his testimony.
Mr.
Chairman, if I may respond to the senator's comments. I thank the senator for the comments. The interplay is a complex one, and the Chris S. settlement agreement is a core part of this. The state has already committed to serve all people with mental illness and to expand the system and expand the care system to achieve that goal. That is a commitment that the state has already made. It is an issue of the state abiding by its commitment and continuing to expand and foster that growth. There's a lot of unfinished business in the Chris S. settlement, including people remaining in jails unnecessarily, a number of issues with the lack of an effective crisis management system, which was contemplated there, and the continuum of care not being fully developed yet. But there is a commitment the state already has made to do this. This is not new. This is already an existing commitment. The Fisher case stands for the proposition that cuts in the funding of services that destabilize people can lead to a violation of the community integration mandate of ADA Title II and Olmstead. And so that is also controlling law that does deal with this. As Dr. Hackman noted, I believe in his comments, that this is going to be very difficult to provide services with the overlapping layers. And with the reduction that is likely and has been acknowledged, this is at least an interplay that needs to be wrestled with and considered.
Mr. Hayes, are you ready to testify? That is why. Thank you.
Chairman, I am. Thank you. Chairman Driscoll, members of the committee. I'm Scott Hayes. I'm the Executive Director for Fremont Counseling Service in Riverton and Lander, Wyoming. And first, I think there are some good things in the bill. And I appreciate the intent and the thought that has gone into this. I think the gatekeeping language is good and much improved. I think the idea of subsidies to help smaller, more isolated clinics stay open is a good thing. I think the concept of priorities makes sense. All that said, and I understand that the idea of policy first and then decide how later. But I think a couple of my concerns is that there are so many unknowns. There's so many unplanned pieces to this. The payment system and payment structure is unknown. Implementing and operationalizing the subsidies is completely unknown at this point in time. Operationalizing the tiers and the priorities. And what we do have a wide array of services, and people have mentioned that before. And we don't really understand the impact that this bill may have on the entire system and on the people that we serve and on the people that serve them. And I've got some, concerns about unintended consequences that may be significant at a time when we are still in a pandemic. We're emerging from it. We're struggling to deal with all of that entails. And we just don't know, we don't know the impact that this bill may have. I've seen no study on systems impact or analysis thereof and how it might impact centers like myself or Fremont Counseling. As a for instance, what do we do with the people who are already in our care that don't fall into a priority population or meet any of the funding categories here? We have a medical obligation to continue treatment for those folks. And then there's somewhat of a dilemma. How do we determine eligibility for some of these tiers and some of the groups within them without providing an assessment, which then incurs that obligation to continue providing services? And if we don't, we're really at risk of abandoning the patient and opening up some liability in that respect. So those are some of the concerns I have around the unknowns and the unplanned piece. And then beyond that, this does represent a fundamental shift in the system. And it does, as people have mentioned it before, sets the stage to move away from, we're going to try to take care of at some level of all people in Wyoming versus, some will not or may not have access. And so, I have really a concern about that, philosophy, that fundamental change in the philosophy. Folks, those are my comments, and I'll stand for questions and do my best on that.
Question, Mr. Hayes. Seeing none. Oh, Senator Case.
Mr. Chairman, thank you.
I think you'd let a hometown guy go.
He's been very generous letting me go, Mr. Chairman. Hello, Mr. Hayes, how are you? It's Kill Case. Listen, what does your testimony mean for us to have this in front of us right now? And I'm not an expert. You're not offering specific amendments. It's kind of some vague, and I kind of get it, but it seems like to me that we're going to have to put this in and tweak it as we go along and find out where the problems are. But there seems to be enormous amount of work that's gone into it, and you know, except for maybe protection advocacy, it seems, and I think their testimony even was perhaps off base in the sense that this prioritization seems really important when we have limited resources and even more limited down the line. So what do you expect me to do? I know you wanted me to vote no on this, and I heard from Mr. Rogers over in Riverton, and I'm having a hard time coming to that.
Chairman Driscoll, Senator Case. Yeah, there's no quick, easy fix on that one. Like I said, there are some good things in the bill. Would it be possible to authorize an impact analysis on this, working towards a way to guarantee, if you will, a general access model of some kind that still establishes the priorities and still establishes some budget savings for the state? I mean, this entirely is dependent upon, you know, the revenue and the budget picture. And I know that Deputy Director Johansson has said that he believes that they could fund in some level all tiers. The reality is, I don't know that we don't know, you know, how this is going to play out. And so my thought was to do an impact analysis or a systems analysis and maybe find out, take a little more time, because I think there's some good things in the bill, like I said, but maybe we could find out some things. So that's my answer to that.
Good question, Mr. Hayes. Questions? Thank you, Mr. Hayes.
Thank you, gentlemen. Appreciate it.
Ms. Foland, you ready to testify? Welcome.
Good morning, Mr. Chairman, members of the committee. My name is Cheryl Foland, and I have two roles that I hold. First, I'm the legislative advocate for the Wyoming Association of Addictions Professionals, and I'm also a full-time independent mental health and substance use disorder provider in Rawlins. So I'd like to echo what Mr. Hayes had said, and also with Dr. Hackman. There are good things in this bill when it comes to the definitions, Title 25. I would also state that Senator Scott is on target with reimbursement rates. I'm the capitalist here. I'm not a nonprofit. I'm for profit. I'm one of 5 licensed providers in Carbon County. Our mental health center has 2 full-time people, boots on the ground, and that's it. That's all we have. As a provider, one of my challenges with this bill is the subsidies. Not only are you asking me as a provider to shift my taxes to my competitors. So now I'm funding my competitors, but you're also reducing my ability to make money because I am not a nonprofit, therefore I don't and am not eligible for the funds from the state as is written in this bill. And the majority you will find of private providers in Wyoming are not nonprofit. That's a huge cost for setting up a nonprofit business. which most of us are single providers. We operate, we're a one-stop shop in our offices. The other concern I have with this bill is if the mental health centers are unable to provide, and I'm not approved by the Department of Health, then they show up on my front doorstep. And Representative Wilson is absolutely correct. We're not limiting service. I just am not going to get paid for the service I provide. And then you place another component into this, which I have a ethical responsibility to see someone who is in an acute state, who may not qualify for these funds, or may qualify, but I don't, for reimbursement. And I might as well turn my entire business into a pro bono, which I do quite a lot of pro bono work. My accountant's not real happy with it, but that is a decision that I made. I would encourage the committee to follow with Mr. Hayes's request for an impact study. We would certainly love to be part of that and the further discussions. I think I would encourage the committee to not vote for this bill as written. I do believe my colleague, Andy Somerville with WAMSAC, has some proposed language, at least from that perspective on their side. And with that, I stand for any questions.
Question, Ms. Folland. Thank you. Do we have anyone else in the waiting room?
Mr. Chairman, no one has their hand raised at the moment.
Okay, last chance. If anyone's in the waiting room, please raise your hand. Do we have anyone else in the audience to testify? Welcome.
Thank you, Mr. Chairman, members of the committee. My name is Andy Somerville, and I'm the Executive Director for WAMSAC, the Wyoming Association of Mental Health and Substance Abuse Centers, with whom this bill mostly applies. So I want to start out by just giving a very a brief introduction to what this system really looks like in Wyoming and how these changes may impact the system. So right now we have 17 community mental health centers. They serve all 23 counties. There are a couple of centers that have more than one location to cover some of the more rural counties. They provide services in mental health and substance use disorder to a variety of community members. Right now that is based on a sliding scale fee. So I know that there has been some discussion about providing access to all. That's not necessarily what the community mental health centers do. They really provide access to people that can't afford access. So right now, the community mental health centers run a sliding scale fee in the range of usually about 300%. So if you're on the lower end of the poverty scale, you're going to pay less of a copay to have access. If you're on the higher end, then your copay becomes larger. So what we really want to talk about just a little bit is what our mission is and has been for a number of years. We provide that access for people that don't necessarily have access. And one of our core issues that I think you've heard discussion already about today is diversion in terms of trying to keep people in their community receiving treatment in their community. I think that's a core piece of the community mental health mission and something that we work with in cooperation with the state. Some of the services that community mental health centers provide, case management, counseling, group services, gatekeeping, family therapy. They provide residential housing. It's a very exhaustive list, probably take about 2 pages to list everything out that they do. In fiscal year 19, they served over 16,000 people for outpatient mental health. They served 6,200 people for outpatient substance abuse. They served 370 people in crisis stabilization, which is a key to the diversion program to prevent them from going to the state hospital. And they provided 69,000 days of residential service for substance use disorder. So just to kind of to show you the breadth of the system that has been developed. Specific to this bill, I think we've heard already a little bit of some of my comments. One of the things we really do like is gatekeeping and the definition that's in there. And I have to give kudos to the subcommittee that worked on this all interim, in particular Representative Larson, Representative Wilson. We have been at the table all summer discussing these changes with Senator Scott, or Chairman Scott. And so we want to highlight the good things that are in the bill. The recognition of some of those populations as being critical is important. Priority population designation is something that we already have as required by our SAMHSA block grant that the state receives to fund these services. Right now, the SAMHSA block grant has some fairly different designations for priority populations. Serious emotional disturbance, which is for children and adolescents, serious mental illness, those are both contained in this bill. But what's not in there is some of the SAMHSA definitions of pregnant IV drug users, pregnant women, IV drug users, parenting women, and veterans. Those are SAMHSA designations that we currently have to serve as priority populations. We appreciate the flexibility within the tiers for local needs. That was a very important discussion point during the summer. We may have some areas of the state, and in fact we do, where we serve a relatively high number of criminal justice involved already. But in other counties, that percentage is much lower. And so we do need that flexibility to be able to address those needs. I would be remiss if I didn't let the committee know that we have been hearing some criticism from our partners over the bill. Concerns I think that were already brought up, including just the basic fact that this will reduce access. And for our centers, it's really important that we manage expectations for everybody, because this will be a fundamental system change. And there will be people that will no longer qualify for services at the community mental health centers. The community mental health centers funding and community interactions are complex. Their funding is not just the state contract. It is county commissions, city councils, grants, private giving and fundraising. All of those pieces play into keeping the doors open. And so we have heard some criticism about what that reduction in services will do to the communities and who will pick up the pieces. To be honest, we don't have an answer for that yet. The system in Wyoming really depends on our public providers, which is us, and our private providers. And I think you've heard some testimony about the concerns about, is it pro bono work, or how do we get these people in for services? We don't have that answer yet. But I would say that this discussion so far, this is step one of the discussion. If this bill moves forward, there will be probably considerable discussion moving forward in the next interim. Specific issues I'd like to raise that we would appreciate some consideration on page 17. Starting on lines 14, the very last word starts the sentence, this paragraph deals with the subsidies to help keep our smaller centers and our rural centers open. That is a very big concern for us as community mental health centers. As the population is reduced, a lot of these smaller centers are just not going to have the population they need to be able to keep their doors open, frankly. And I think we can all agree how important it is to try to keep access, and especially the rural isolated areas. So starting on line 14, it says the amount of the essential subsidy payment shall be subject to the available funding and based on the total population of the geographic area. Sorry. Oh, that's what I had in my version, but that might be, it would be the bottom of, oh, yes, thank you very much. So it would be, I apologize, Mr. Chairman, Senator Case, thank you. Just making sure. Oh yeah, looking for the 35-mile radius. The next page. Okay. Thank you, Mr. Chairman, Senator Case. I apologize for the confusion. Page 17, I actually moved down on the engrossed copy. This paragraph discusses the behavioral health subsidy. And so if we start with just line 1, the amount of the essential subsidy shall be subject.
You said page 17
Page 17, line 1
of the green copy?
of the green copy.
Line 1.
We're not.
Should start with
Okay.
amount.
Line one, it's the middle of a sentence.
It is.
Amount of-
Payment.
Okay,
Right.
I'm sorry.
Thank you, Mr. Chairman. Senator
Yes,
Case, I
thank you.
apologize for the confusion. So the sentence, and I think we'll get the gist of it, it says the amount of any essential subsidy payment shall be subject to available funding and based on the total population of the geographic area served by the behavioral health center or other provider and the number of other behavioral health care providers within a 35-mile radius. I want to draw your attention specifically to that line 5, the end of the sentence, where it's behavioral health care providers within a 35-mile radius. Well, we understand the intent is to help support the centers where there aren't a lot of other mental health resources that maybe our larger communities have. We have a request to remove that, the last end of that sentence based on the behavioral health care providers within a 35-mile radius. To be honest, it's just not logistically possible. We can get those numbers from the the mental health licensing board on the number of providers, but what we can't tell you is what those providers actually do in a specific area. They could be school counselors, they could work for DFS, they could do a number of things that may not actually provide some type of mental health access to the general community. And so while we understand the intent, and to be honest with you, we do not have a recommendation on how to fix that yet. We'd like to remove that last piece of the sentence and continue to work that out with the Department of Health.
Mr. Chairman.
Senator Case.
So you'd like to put a period after the word providers on line 5?
Yes.
I get your point about there being providers have different capabilities or different specialties, or wonder if we could fix it a different way. I'm just throwing it at you. On line 4, it says other provider and the number of, if we insert the word and capabilities after the word number, so it's and the number and capabilities of other behavioral health care providers within 35 miles. Then they could still use the 35 miles. Oh, now I got my friend jumping all over me. Anyway, I'm throwing that out, maybe too premature.
Thank you, Mr. Chairman and Senator Case. Well, I appreciate the effort. The problem is we can't actually tell you where all those people work.
I see.
Necessarily. Some employers provide that information to the mental health licensing board and notate an employer, but it would probably be a pretty big dive to go through and pull that information out. And I would certainly just defer to Greg Searles from the mental health licensing board on that, but that question has been raised in the past.
Thank you.
Further questions from Ms. Somerville?
Mr. Chairman, I apologize. I have
Senator
a
Scott.
couple more points.
She wasn't done.
Oh.
Yeah. Yeah.
Go ahead and finish, Ms. Somerville.
Okay, thank you, Mr. Chairman. So the other piece that we wanted to talk about was the timelines that are set out. So as it was described, I'm looking in the green copy here for the date. On page 24, line 21, the report date for the Department of Health was moved to September 1, 2025 due to the delay in the delay in the session, which we do appreciate. However, we have to be very honest with you. Oh, right there. And I apologize, it's also on line 1 of page 24. The concern is that we may not be able to make those deadlines. What we're talking about in this section, in section 4, is a pretty giant to-do list of things that haven't been accomplished in terms of the conversations of how to move the system. I would also be remiss if I didn't say that our community mental health centers are undergoing pretty massive change right now in relation to the budget cuts that they're going to take this year. They are working on, reducing programs and reducing services. And then we're asking right now to spend about 5 months trying to reform the system to fit into this bill while doing a massive payment reform package that's in this. Payment reform is not an easy lift. And from our provider's point of view, it's going to take some time. I don't necessarily have a recommendation on how much time that needs to take, but I don't know that come September of next year of this year that we're going to be able to come to you, to any committee, and say that the work is done and we're happy with the result. The other, regarding the timeline, the implementation of July 1, 2022, the same concern exists. In terms of us actually being able to do the heavy lift on the back of a pandemic while doing a massive reform package. We do appreciate the delay, as not making this effective this year. But I cannot promise you that I will not be standing here during the next session telling you that we're not ready and that we can't do it yet. And I need to be very honest and transparent with the committee on that.
Senator Nethercott.
Thank you, Mr. Chairman. Ms. Somerville, I hear what you're saying, but you don't have a proposed date either. It's not going to get easier. So if we're looking for a time when it's going to let up, I don't think that that's going to happen. So what do you propose we do? Right now, I'm just inclined to leave it.
Mr. Chairman, Senator Nethercott, if I had to give you a proposal, it would be to kick it a year.
Senator Scott.
Mr. Chairman, general questions. Ms. Somerville, we've heard some criticism of the priorities here as not being adequate to prevent people from being institutionalized and whatnot. And wanted, you see the priorities set on page, what was it? Page 16, and then you have to go back and look at the list on page 10 and 11. And in that top tier on page 16, you've got state level justice involved, non-state level justice involved, looking at the bottom of page 10. Now, those are people that are at risk for institutionalization because they're already institutionalized or have been. Is that not right? Then you have the families at high risk, again, the risk of institutionalization, and the adults with acute mental illness and severe mental illness. Is that a proper prioritization in order to ensure that the services go to the people that are most at risk of being institutionalized?
Mr. Chairman, Senator Scott, I'm not sure that I can completely answer that question. In formulating a priority population list, there are always pieces that get left out. And one of the criticisms that we have heard directed towards our centers is that the bill doesn't prioritize any type of early intervention. So essentially somebody has to, let's say somebody is in the 200% of poverty level, they won't qualify under tiers 3 or 2 because of the financial qualifiers. They will have to wait until they become either seriously mental ill or end up in crisis or at risk of institutionalization before they come into tier 1. That's a valid criticism because we don't have, as you're cutting out general access, that piece of the services, that earlier intervention, grabbing somebody before they go into crisis, that will go away.
Senator Scott, follow up. Other questions?
Might be fun to watch, Mr. Chairman.
Welcome.
Thank you, Mr. Chairman, members of the committee. My name is Lindsay Simoneau, and I have the opportunity to represent the Wyoming Counseling Association today. My comments will be brief because a lot of them have been addressed by those online and Ms. Somerville. As Ms. Somerville stated, there are 17 community mental health centers in 23 counties, and they're getting ready to experience a 15% budget cut. In doing so, as Ms. Somerville highlighted, yes, that includes programs. As some of my membership has given feedback to me who are working in those community mental health centers, that will also include layoffs and possible mergers of different clinics in order to be able to adapt to that 15% budget cut overall. At the same time, a lot can happen between now and then. We do know that there's COVID money from December that could possibly come in and fill those budget holes. We also know that from the COVID Act that was passed in January, that there will be possible funds there on a state level to help states specifically with their mental health crises from this global pandemic. However, we do not know the timeline of when those dollars will reach our community mental health centers. So I would like to echo what Ms. Somerville said about the report date. Between the budget cuts, possible mergers, possible layoffs, and that report date of September 1st, it's a lot to ask for my membership, a lot to ask in order to produce something that would be possible for the legislature. The date that we would land on would be January 1st, 2023. And the reason for that is we like the 18-month mark. As we've seen with the CARES Act that was passed a year ago, it's taken about a year to get those funds, appropriate those funds, and see the impact of those funds. If that COVID money is available, it gives us time to settle that COVID money and then take up payment reform. It also, if there is a very possibility of Medicaid expansion happening, we can have time to rectify with that. And so that would be our proposed date. And I stand for questions.
Questions, committee? None. Thank you very much. Representative Larson, you like to come back up? You get 2 minutes for rebuttal.
He's kind of the Jackie Gleason of the House.
So,
Really light on his feet.
Mr. Chairman, thank you. I just, as you guys consider some amendments, I just wanted to kind of help you understand a couple of things in the structure of the bill. To Mr. Hayes and to Ms. Somerville's point, Mr. Hayes says we don't know a lot of these things, how it's going to be implemented and all of that. And that's what Section 3 is all for. That's what these folks in the Department of Health are going to figure out all this year is the methodology, the payment system. All of that is to be this year. When you look on page 17 on the subsidy and the geographic area there, that's right. How do we completely do that? But then if you look over on page 22, we talk about that in this interim. Eligibility requirements for receipt of essential subsidy payments as created in order to target geographic areas and inadequate. So that conversation will carry on this year to determine how that's implemented. We've had that discussion, as she pointed out repeatedly. We think that conversation should move forward. And so that's why I was kind of saying I think we have that in place. The report, this doesn't go into effect till 2022. We put the report in there for this year's, okay, where are we at? What's going on? It's not a deadline that you have to have every I dotted and every T crossed. We want to know where you're at so that then if we need further instruction, if they have further requests, we can help that process move so that it's implemented in 2022. So just wanted to throw that out there.
Thank you, Mr. Chairman. Section 3, I was reading about the report on page line 21. It's a gross bill, section C there, line 21 carrying on to middle of the page 25. That's the report you're talking about.
Yes. No, Mr. Chairman, I'm talking about the report on the engrossed version on page 24 on the top on line 1.
Okay.
Which is September.
What's the difference between the two reports?
So after this is implemented, the one down at the bottom of 2024 is we want to be able to, after this has been in place for a few years, look back, have a report and say, where are we at? Okay. How has this gone?
All right. So that's why it says 25.
Yep.
Senator Scott.
Mr. Chairman, question on the effective date on page 25, line 17, July 1, 2022. Is that a House amendment? It seems to me I remember July 1, 2021 on the bill as introduced. And my question is, why do we need to go to 2022? The intent of the priority system was to enable us to deal rationally with the budget reductions that were expected in this session.
Mr. Chairman. No, Senator Scott, that's the date that has always been in there because recall we're implementing this similarly to what we've done with some of the other previous, like with the state facility stuff that you helped participate in. It was in the Medicaid reform. It was kind of a two-step. Establish the policy this year, give them a year to figure out methodology, and then implement. And so that was that end date, 2022 was always in there because they need this year to kind of get the plans together.
Questions? Questions?
Thanks.
Thank you, Representative Larson. You've done a great job on a pretty complicated issue. Thank you. Further testimony. Oh, Chairman Wilson, excuse me.
Mr. Chairman, thank you. If I could
You
just
blend right in.
circle back on the dates there for a moment, and you may imagine I have a number of notes in response to people, but I won't share them right now. But regarding the September 1, 2021 date for the preliminary report, and that really is preliminary, we, Labor Committee has put in potential dates to LSO for our meetings, and we would anticipate having our second meeting of the summer about the second week of September, and then one in November. And specifically with the benefit of having a September 1 date, that enables us to consider if we need to amend this legislation in the next session in response to what obviously will be preliminary discussions this summer. But I think it's actually important for us to have that report there by September 1 of this year so that we can, in fact, circle back if necessary. Mr. Chairman, that's all I had to say there.
Question for Chairman Wilson.
Move to pass.
We gotta make sure we're totally done.
I hope so.
Do we have anyone left anywhere? Okay. Public testimonies closed. We have a due pass. Senator.
Mr. Chair, my apologies, Mr. Chairman, someone just raised their hand online.
We're closed. I think we know where we're at. We'll go ahead and close.
Okay.
Senator Scott.
Mr. Chairman, I would summarize the testimony we've had against the bill, other than some technical points, as being primarily a complaint about the effects of lack of funding. And that's the nature of the beast. This mental health is in many ways very frequently a spectrum disorder, where you run from very severe cases that require institutionalization to very mild eccentricities, probably which majority of the members of this legislature share it. And you have to draw a line somewhere. You can't fund everything. And that's our job as elected representatives. So I think that this bill is achieving its purpose by setting some clear priorities that are aimed at preventing institutionalization by prioritizing the people that are at the highest risk for it. There is a need out there for services for people who do not fit into those priority categories, who can function well enough to not require institutionalization, but have a mental illness that is nonetheless somewhat debilitating. And that's something where they can't pay for that themselves. That's something that is a mission for the community mental health centers. And that's one of the reasons they have multiple other funding sources, is to be able to deal with some of that mission. So I think this is a rational approach toward putting some priorities in that it will focus our funding where they're most needed.
For the comments committee.
Question.
Question being called, roll call.
Senator Boner.
Aye.
Senator Case.
Aye.
Senator Nethercott.
Aye.
Senator Scott.
Aye.
Chairman Driscoll.
Aye.
Mr. Chairman, House Bill 38 passes with 5 ayes.
Mr. Chairman,
Senator Scott.
for carrying this on the floor, I propose that I consult with Representative Baldwin and see which one of us is going to do it.
Possibly,
Senator Baldwin.
well, and possibly Senator Schuler. I've visited with bill
Okay.
sponsors, so we'll work on that and get it done. 'Cause I think there may be Representative Larson, Senator Schuler potentially, correct?
Mr. Chairman, she was part of the subcommittee, and I thought I would approach her, maybe have her tie back from the senators.
Okay. We'll work it
We'll
out so
consult.
someone knows where it's at. So heavy lift. Okay, we're gonna move on next to the university water system. I'm gonna ask everybody, let's keep everything really tight. This committee's got about 9 or 10 bills left, and we have 2 meetings left after this one and one more. So we're gonna leave bills dead on the floor if we don't be timely.
Who's going to address this on that?
Looks like it's gonna be me probably, because I believe that,
Mr. Crank's here. He can also-
Mr. Crank, would you like to present or would you like me to present the bill? I'm on the bill. Representative Nicholas is left. Oh, yes. Oh, let's grab it. Yeah, that's who needs to present. Thanks, Tara. Chairman Nicholas, would you like to present your favorite bill?
Good morning.
We're gonna try to be quick and get this out this morning, okay?
I can be quick.
Okay, thank you.
So, committee, this is, it's actually,
Mic on?
it is, but I tend to not speak loud, so. This is actually a very simple, short bill, and it takes care of a very simple, short problem. So what's the issue? In the 1950s, the university opened up a golf course, and they had an arrangement with the city of Laramie that the city would provide free water and the city would make it a public municipal use golf course. And that relationship went on until 2007. In 2007, the folks in Laramie said, well, we're going to start charging you for the water that we're supplying you. And by this time it had turned into potable water. So they were supplying potable water to irrigate the Jacoby Golf Course. Between 2007 and 2017, the price that the UW was paying for the for the potable water on the golf course increased by over 500%. So, and as of today, they're paying almost $200,000 a year in just for potable water to irrigate the golf course. So as stewards of the dollars of the University of Wyoming, in 2017, the Board of Trustees determined that they would be better served if they drilled a water well to use to irrigate the golf course. It's that simple. And so a test well was drilled. That test well was insufficient production. In 2019, they made application to the State Engineers Board of Control for 2 other wells on a property that UW had acquired, that the ranch that is the face of the the mountain going up over the top of Tavitavu, which is immediately adjacent to the golf course. They drilled 2 water wells after being permitted. And they were, the permit allows them to do, I think it's about 420 acre feet per year. The water wells produce a lot more water than that, but that's all that they really needed. And they were trying to not overdraw down on the water wells. So as a result, and the reason they drilled the wells is real simple. They're using their land, water wells on their property, which is adjacent to the golf course, to irrigate the golf course. So then on August 4th of 2020, the city of Laramie passed an ordinance. And in that ordinance, they provide that no entity, not the UW or an individual, can import water across the city boundary, even if it's on their own property, for any use without having basically a franchise permit. And the ordinance is rather extraordinary when you read it, because they take control of all of the water groundwater within the city limits. They require, for larger wells, they require annual reports, they require metering, and they can deny the use of your own water well if they believe it's not in the best interest of the city. And that's what it provides for. I think there are constitutional and legal issues with the language from that ordinance. But more importantly, what this statute, this new statute, simply addresses the authority of the University of Wyoming to use their own water on their own property to irrigate the Jacoby Golf Course. And that's all it is. So I'll just take you to the bill. It's very simple. It clarifies the authority of the University of Wyoming over the water that it owns and is permitted on UW property. And notwithstanding, and the important part is down on page 1, lines 12 and 13, Notwithstanding any municipal or county ordinance, the University of Wyoming may develop, drill, operate, and maintain water lines and water systems for irrigation. And it currently now reads, because it was amended, for non-potable water. And they can, then the next it provides you, they can hook up to buildings, and then it goes into the authority of municipalities at Wyoming Statute 15:7-701. And it says, notwithstanding anything in that article, it can't be construed to prohibit the use of the University of Wyoming to use its water wells. So a very simple 2-page bill. So what's the controversy here? Well, in essence, the city says, we want you to continue using our water, number one. And we want you to pay us $200,000 a year for the use of that water. Number two, the city says, we want to have more control over the aquifer to protect our water rights. And on both of those avenues, I can understand the desire of the city, but I would respectfully submit that that's outside the authority of the city to say, we can control how much water you have. That's in the exclusive purview of the state engineer's office and the Board of Control. This well has been properly permitted. It was tested. They did thorough testing on the side to see if it had any interference with any surrounding water tables or other water wells, and it did not. And both entities have a fiduciary duty to their respective clientele. But the water laws are water laws, and you can't usurp the authority that was granted by, number one, the state engineer's office, and a personal property right that is owned by the person that owns that water well. And so that's the well, and that's how deep it is. So
Questions for Chairman?
Happy to entertain any questions.
A couple, Mr. Chairman, if I could.
Senator Case.
Mr. Chairman, Senator Nicholas, when I served on appropriations quite a few years back, I remember there were appropriations for the Jacoby water source. And I thought it involved a well more than a decade ago. I mean, is that possible?
That's correct. Those funds were appropriated. And so that's how long this issue has been going. It wasn't quite that long. It was about 2017. I think
it's before that.
2016 was when we appropriated the dollars.
16, I was on water.
And that's when the good Kermit Brown was Speaker of the House. That well that was drilled was insufficient. It did not provide enough water. And so they had to come back.
I get it.
And then the good part was once they purchased the property, they were closer and adjacent to Jacoby. And so these wells are literally, as a crow flies, about 500 feet from the golf course.
So this was a lot longer back than that?
That could be.
I mean, it might have been a whole nother instance. Can I ask just a couple more? Does the university use treated water for the rest of its grounds and facilities?
The answer is yes. Currently, UW pays the city about $1.9 million annually for their water. And so of that, 200,000 of it is just the Jacoby Golf Course. The rest of it is their potable water and for what they use on the campus. And they are still paying that and will continue to pay that.
So for irrigating common lands or grounds, they use potable water? Could they drill other wells and achieve?
I believe there is one water well, a shallow water well on campus that they do some irrigation on as well.
Thank you. I'll stand.
Senator Scott.
Mr. Chairman, am I right in thinking if there is interference by the university's well with a prior right on that aquifer, then the owner of whatever well is being interfered with can appeal to the state engineer and the Board of Control and get regulation. And I will tell you, I've had personal experience, Mr. Chairman, with exactly that happening. But that would apply in this circumstance, not be changed by this bill. Is that right?
That's correct. That's once again, that's the law of the land. There is a well that is on UW property that was called well 4133. That was permitted to the city for city use. I think it was in 1942. That well was abandoned in 1977 and was never operable. The city at this time has renamed a new well permit, 4133, which is they are hoping to drill on or adjacent to a city street not too far from my brother's house. And I think their intent is to go down to the Casper Aquifer. And that may be an issue, but the prior well doesn't go to Casper Aquifer. It's in the chug water, and so they don't interrelate at this time.
Senator Scott, none? Senator Nethercott.
Mr. Chairman, thank you. Representative Nicholas, is the university paying or compensating in any way the private landowner for the well or for the water usage?
They are the landowners.
Okay.
All of this is on UW property and serving UW property. And to transfer the water from the well to Jacoby, it will all be transferred on UW property. All the ordinance says that you can't bring your water across your land into the city without getting a franchise from us and essentially paying us for it.
Mr. Chairman, I'll do a follow-up on that. I don't want to bog us down in time, but I guess my question is, why does it just apply to the university? I think this is probably universal across the state of Wyoming. Is the issue to me is a broader issue, and I don't expect you to elaborate a lot, but I think this is going to occur anywhere. This is an issue between power of cities to control property of the state of Wyoming, which is our water, and interfering with state engineer rules and laws in place. We have, I would guess this city here, looking North Cheyenne, that there's hundreds of wells that are going to end up in the city limits at some point. And are we going to allow cities to control whether you can irrigate with your own water or force you to pay to use theirs?
I would agree, Mr. Chairman. There are two issues, really, two legal issues. One is, what authority does a municipality have? Well, obviously, they're creatures of the statute. We created them, and we established what their authority and what they can and can't do. And number two, and as a result of that, does a city have the power to override actions taken by the state engineer's office and with regards to water rights? And I would submit that they do not. They can regulate to certain matters to it, but they cannot deny you the use of your water. Number two is the state of, the University of Wyoming is the state of Wyoming. It is constitutional, and it is everyone. And it has its own authority to manage its own lands and property and assets, just as the state of Wyoming does. And so I think it is another legal issue on, can the city of Laramie dictate how the University of Wyoming, a constitutionally created entity, use its lands and its waters? And I don't think they can. And so there was an amendment brought on the House side that limited this to only irrigation for miscellaneous uses to be used for landscape, watering, lawns, and athletic fields and trees, shrubs, and flowers. And I would ask that this committee and the Senate consider removing that amendment, because UW has lots of different lands and ownership properties around the state. They have an ag college. And this ranch where this is located is 1,200 acres. Under this strict language, they can't use this water well to let livestock drink out of the water well. And so even though they're trying to keep it to irrigation, and UW has no intention of using this water for anything but irrigation on Jacoby, but the bill, as it's drafted, talks about all university property, and it doesn't make sense to limit the use of all water wells in the state that the UW owns to just irrigation, when it could be used for whatever uses a college might use it for. You might want to use it for a ranch property. You might want to pump it to a ranch house. You might want to use it for the College of Agriculture. Yes. Or for.
Sorry to interrupt.
Representative Nicholas, where would you want that amendment to occur?
I'm sorry?
Where would you like that amendment to occur?
So if you go in, you'll see House Bill third reading amendment number 1.
We don't have.
Page 2.
Page 2, line 3.
Yeah.
Just on the engrossed version. Representative Nicholas, do you have the engrossed version?
I don't, but I have the amendment, and I can just give you the amendment and you can just
Yes, sir.
undo the
Stop
amendment.
at page 2.
Well, I see where it is.
Yeah. So you just
I
go
see
in
the
and,
paragraph we're discussing. Do you have a proposed amendment, Representative Nicholas?
yes, I can.
If you'll pull it together, if you're near the end, I'd really like to get this out this morning. If you'd allow, I'm going to bring the city up here, and I
Yes.
don't think we're going to do any other testimony. We know the issue.
No, do full public comment, but hear from.
We'll do
everybody.
comment, but-
Yeah.
I'll draft the amendment and just hand it to you while
Great.
you get other testimony.
Thank you.
We have a representative from the city here online. Right here. Perfect. I knew they'd be here. Welcome and thank you.
Good morning, committee members. Thank you. I'm Janine Jordan. I'm the city manager for the city of Laramie. Excuse me. I'll note for the record that Mayor Weaver is also intending to address you this morning. He's attending by video. And
We have him
understand-
admitted as well. Thank you.
I understand we also have a number of community members who are interested in speaking with you about this. So while I appreciate your urgency, I would ask for your indulgence because this is an exceptionally important issue for the 32,000 people that reside in the city of Laramie and pay water rates to sustain a $6 million water system annual operation, and whom could be affected very significantly by this bill. So I'll start off by reminding the committee members we learned at about 4:30 yesterday afternoon that we should be here at 8 o'clock this morning. So with haste, we distributed to the members of this committee information that has been previously also shared on the floor of the House and with the Senate, or excuse me, with the House committee that reviewed this, as well as all members of the House of Representatives. We spent the last 2 weeks effectively chasing our tail to correct misinformation that is being perpetrated about this particular issue. So again, I ask for your indulgence because it's important to us and to the City Council that we have opportunity to address that information and set the record straight. So I'm referring to the materials that you've received. I'll note for you 3 exhibits were provided by email. The first of which was a letter that remains unanswered by the University of Wyoming that was submitted by the city to the University of Wyoming on November 5th of 2020. I provided to you an email, a link to all of the historical correspondence on this issue going back to 2015. This November 5th letter that I put in your hands is simply the most recent. The reason that we were asked by our water attorney, Cord Lewis, to provide this letter to you is that this letter restates 4 solutions that the city had proposed to the university between the years of 2015 and 2017 that remained unanswered, but we restated them here for historical reasons. One of you had asked the question of when this issue began, and it is correct that it began in the 2015 session, Senator Case, with an appropriation, and it was correct. I believe Mr. Brown, Representative Brown, had brought that forward. At the time that was brought forward and that money ceded to the Water Development Commission, the city immediately went on record in writing, and all of these materials are available on our website, to offer alternative solutions that would provide really a regional water management strategy that could not only solve the irrigation needs of the University of Wyoming, but also solve the irrigation needs of the other 2 largest irrigators in Albany County, Laramie particularly, which are also public entities, the Albany County School District and the City of Laramie. City offered to even bring our surface water right in the Laramie River to bear to really bring a holistic solution that would be mutually beneficial to all of those parties. Again, to this day, that remains unanswered. So I'll walk through, if you'll indulge me, the 4 solutions that were offered prior to 2020 remaining unanswered. The first one was what I just described, that we would complete a raw water or purple pipe irrigation feasibility study. The city would bring to bear our Laramie River diversions. We would look at that in totality with our groundwater rights in the aquifer and really trying to bring a regional solution that frankly could turn Laramie green and beautiful and make our campus a shining example in the Mountain West. The second option remaining on the table in those years previous to 2020 was that we had offered the municipal water utility would co-invest with the University of Wyoming in development of the city's existing well. It was referred to here as the 4133. It's actually 41T3, but it is correct that the city has owned that well since the 40s. We have had it in our capital planning program since, I believe, 2013, I think, to drill that well deeper and actually weave it into our water system as a fully productive well. So we offered in 2015 that the city and UW co-invest in a plan we already had to develop the 41T3 well, and to then allow raw water to be piped off that wellhead to Jacoby Golf Course. And then we would, subsequent to that initial raw water feed it into our potable system. It's important to note that the 41T3 has been programmed by the city for years to be brought into our production system. And the wells that the university have subsequently drilled a year and a half ago are 70 feet from the 41T3 well the city has owned for 40 years and offered in 2015 to partner with the university on. Option 3 that was on the table previous to 2020, we offered that our municipal water utility and the University of Wyoming could co-invest in installing a transmission line from the city's existing Turner well, which is slightly south of the golf course. And we could use that water line to connect Jacoby Golf Course for the purpose of delivering raw water. The fourth option on the table prior to 2019, we offered that if the university wanted to irrigate the entire campus, not just Jacoby, but the entire campus with raw water, they could utilize our existing Turner 2 well on Grand Avenue, the one I just previously mentioned, which is within a half mile of Jacoby Golf Course, just to give some perspective to that. We offered that for raw water irrigation. In all of these instances, we had offered with the university that if they would partner with us in the initial capital expense, that the raw water that we would deliver to the golf course subsequent to that initial investment would be completely free. It makes sense for us to deliver non-potable water. I also want to mention to you that University of Wyoming is drilled now into a Class 1 potable water source. That is the Casper Aquifer. But they have 4 other wells that have existed for decades in the Chugwater formation of the Casper Aquifer, which are in fact non-potable. My understanding is that some of those wells have been silting in over time, and because of that, they have had to increasingly rely not for Jacoby Golf Course irrigation, but for irrigation at other recreation fields.
Short, we're gonna have to go over. We're 3 minutes from going in, and we will continue this on adjournment today.
Okay,
So, right back here. Thank you all. Sorry that we got chopped up.
Thank you.
I'd ask any of the public that's got comments, those of you who can make them in writing to us, it would be helpful. We are really time constrained. Thank you.
Thank you.